And time to talk about measles, with cases on the rise across Canada and beyond. The Nova Scotia Health Authority announced there is a lab-confirmed case of measles in Pictou County, and 2 hospitals are measles exposure sites, the Aberdeen Hospital in New Glasgow and St. Martha's Regional in Antigonish. Measles is a highly contagious illness that poses serious health risks to some people, although the risk is relatively low for those who are vaccinated. Here to discuss measles this morning is Dr. Kristen Muick, a regional public health officer in Nova Scotia's Northern Zone. Good morning, Dr. Muick.
Good morning, Crystal. Thanks for having me.
It's our pleasure, and so timely to have you in right now. Well, let's talk a little bit about the 2 hospitals that are exposure sites. What do you recommend people do if they think they may have been exposed to measles?
So if you think you've been exposed at one of the exposure sites, it's important to reach out to local public health, and we can direct you as to your next steps. In general, if you think someone in your house or you've been in contact with someone who may have had measles, and you feel that you might be at risk, it's important to reach out to your local healthcare provider for advice. You can call public health directly. One of the things that we like to emphasize is if you think you might actually have symptoms and be infected, it's important to stay at home until you get further advice. If you feel that you need to go to see a doctor or nurse or go to potentially to the emergency department, it's always really important to call ahead. As you mentioned, it's a very infectious illness, and so you certainly can and should get clinical care, but it's important that the sites be prepared so they can prevent other people from being exposed.
How concerned do people need to be when there's a measles exposure? For example, those who are vaccinated, I understand the risk is relatively low, so who needs to be concerned about this?
So you're absolutely right that vaccination is the best protection against measles. So we do recommend 2 doses of measles vaccine. Since 1996, it's been standard for children to get 2 doses of vaccine. There would be a cohort of adults who born between 1970 and 1996 who potentially could have only gotten 1 dose because that was the standard and recommendation at the time. So there may be folks out there who are eligible for an additional dose. All measles vaccination is free and accessible and safe. And so we do recommend that people check their vaccination records to make sure that they have all of the vaccinations that they need. There are folks out there, as we know, who choose not to get vaccinated for a variety of reasons. There are also folks out there who either can't get vaccinated or the vaccine is not effective with them. For example, people who are immune compromised, women who are currently pregnant. The vaccine is not usually recommended during pregnancy, although it can be provided both before and after pregnancy. And very young babies, so typically children under the age of 1, are actually too young to get the vaccine because they don't get the standard immune response. And so when you get vaccinated, you're not only protecting yourself, you're also protecting those that are vulnerable around you.
Okay. Now, why is measles so contagious?
It's one of the few viruses that we know that is considered to be airborne. So it sits in very tiny droplets in the air that can remain in the air for a period of time, even after the person has left the room. So unlike other contagious illnesses where it may be in larger droplets, so coughing and sneezing, and those droplets will drop out of the air quite quickly, it can stay suspended for a long period of time. And in fact, the evidence shows that if someone with measles leaves a room, the air in that room can contain measles virus for up to 2 hours after they've left.
And then it seems like with travel season happening right now, more people on airplanes or more people in contact with each other, that the risk for measles spread does go up this time of year. Well, we appreciate you joining us this morning, Dr. Muick, to let us know what we should do. And if just in general, if people have any questions or concerns, should they reach out to their family doctor? Should they call? I guess what advice would you give to people if they do have questions about measles?
Sure. It's really important to speak to people, trusted professionals who have the right information. So, your local healthcare provider for sure. You can check out our website at www.nshealth.ca/measles. And really and make sure that you fact check and use reliable sources of information.
Perfect. We'll put that website on ours as well to make it easy for people to get that information. Thank you again for your time and have a good day. CTV
Thanks
Morning
so
Live will
much.
take a short break and we'll be right back after this.